Avoid these 18 worst everyday habits that can rapidly damage your kidneys. Are you inadvertently harming your kidneys with your everyday routines and habits? Some activities that might seem harmless when repeated daily can silently deteriorate your kidneys, endangering your life. Therefore, don't proceed with your day-to-day activities without understanding these harmful habits. The reality is, 90% of Americans fail to recognize kidney issues until they are severe. Often, our bodies conceal the initial signs of kidney disease, with significant damage occurring before any symptoms are noticeable. Thus, when symptoms finally emerge, such as swelling, brain fog, fatigue, weakness, muscle twitches and cramps, and back pain, etc., it might already be too late, as advanced kidney disease is more difficult and costly to treat. It is critical to acknowledge that most kidney damage, especially chronic types, is irreversible. If the kidneys are compromised, toxins will accumulate in your body, leading to various health issues and intense pain. The most severe scenario is kidney failure, requiring dialysis or a kidney transplant for survival. Here's a simple game changer: your lifestyle. Healthy daily habits can protect your kidneys, while other habits silently damage them. You have the choice: risk kidney damage with harmful habits or make informed decisions to maintain your kidney health. Before you make any changes, understanding the risks is crucial, and we are here to disclose the 18 worst daily habits that can quickly destroy your kidneys. In the next few minutes, we will not only identify these harmful habits, but also provide you with practical tips and solutions to keep your kidneys healthy. Prepare for some surprising disclosures. Before we proceed, please be aware that the information presented here is thoroughly vetted, impartial, and assessed by experts. Now, let's revisit the worst daily habits that can severely damage your kidneys. 18. Consuming excessive salt. Consider the unseen hazard lurking in your daily meals, one often ignored: excessive salt consumption. Salt, or sodium chloride, is crucial for various body functions. Yet too much salt can pose a significant challenge to your kidneys, which are responsible for filtering waste from your bloodstream. Problems start with hyperfiltration, where your kidneys must work overtime to eliminate the excess salt. Essentially, salt particles are difficult for the kidney nephrons to process due to their size, creating increased glomerular pressure. This added strain can not only exhaust the kidneys, but also cause significant damage and disease. Additionally, consuming excessive amounts of salt can lessen the effectiveness of certain medications meant to protect the kidneys, such as angiotensin-converting enzyme inhibitors and calcium antagonists. Excessive salt intake can also upset the balance between sodium and potassium, further impairing kidney function. The World Health Organization, WHO, recommends consuming less than 2 grams of sodium per person per day. Yet Americans typically consume 50% more than this daily limit. Processed foods like instant noodles, canned goods, and pickles are high in sodium and detrimental to kidney health. To promote better kidney health, consider reducing sodium intake and using herbs and spices to flavor your meals instead of salt. For instance, opt for garlic powder instead of garlic salt. Additionally, make it a practice to read food labels while shopping and choose fresh meats, fruits, and vegetables, which generally contain lower sodium levels than their packaged counterparts. It usually takes about 6 to 8 weeks for taste buds to adjust to reduce sodium levels. But after this adjustment, you might find that foods you once enjoyed, like potato chips, now taste overly salty. If you find this video helpful so far, show us some support by liking it, and we'll create more like this. 17. Excessive sugar intake can transform from a harmless indulgence to a significant kidney risk once blood sugar levels exceed 180 mg per dl. At this critical threshold, kidneys begin to excrete sugar into your urine to manage the excess. This might seem like a protective mechanism, but it actually signals the onset of potential kidney damage. The surplus sugar in the blood can damage the tiny blood vessels in your kidneys, impairing their filtering ability. This damage can progress to proteinuria, where the body loses valuable proteins through urine, potentially leading to chronic kidney disease and eventually end-stage renal failure. Moreover, a high sugar intake can raise blood pressure, putting additional strain on your kidneys and accelerating kidney disease. A study highlighted in 2023 by Frontiers in Nutrition and Harvard Health revealed that individuals consuming over 25% of their daily calories from added sugars had an 88% higher risk of developing kidney stones compared to those who consumed less. This finding underscores the importance of reducing sugar intake to protect your kidneys and prevent kidney stone formation. 16. Consuming excessive amounts of meat, especially red meat, increases the body's acid load during digestion more than plant-based proteins. This heightened acidity can strain the kidneys and may lead to the development and progression of chronic kidney disease, eventually resulting in kidney failure. Replacing red meat with other protein sources such as fish, poultry, or plant-based proteins can significantly reduce the risk of kidney damage. These alternatives generate less dietary acid and fewer harmful byproducts such as advanced glycation end products and uremic toxins. Research from 2017 indicated that a diet high in acid-producing red meat, combined with a low intake of alkaline-producing plant proteins like chickpeas, broccoli, or beans, could lead to kidney injury. These findings suggest that excessive meat intake is not only detrimental to kidney health, but could potentially lead to chronic kidney disease or end-stage renal disease, even in individuals without prior risk factors. 15. Excessive strenuous exercise can cause significant kidney damage in various ways, one of which is rhabdomyolysis. This condition occurs when intense physical activities cause muscle cells to break down, releasing a protein called myoglobin into the bloodstream. Myoglobin can be harmful to the kidneys. Risk factors for rhabdomyolysis include dehydration, specific muscle disorders, use of NSAIDs, heavy alcohol use, hot weather, and the intensity of the exercise. A study in 2022 found that while moderate intensity and long-term exercise generally benefit kidney health, strenuous activities can induce immediate kidney damage and exacerbate existing kidney conditions, potentially leading to kidney failure. Additionally, endurance events can trigger acute kidney injury due to pigment nephropathy, a condition where myoglobin from damaged muscles and hemoglobin from damaged red blood cells constrict the kidney's blood vessels, leading directly to damage in the kidney tubules. This risk is heightened in individuals who are dehydrated, have rhabdomyolysis, or use certain medications like NSAIDs. 14. Overuse of painkillers can lead to a condition known as analgesic nephropathy, particularly when pain relievers like acetaminophen or NSAIDs, such as aspirin, ibuprofen, or naproxen, are used long-term. People who frequently self-medicate with these over-the-counter drugs for chronic conditions like headaches or arthritis need to be cautious. Even though these medications are readily available, they should not be taken regularly without medical supervision due to the risk of kidney damage. This risk is compounded in individuals with chronic kidney disease or end-stage renal disease, as NSAIDs can reduce blood flow to the kidneys, impair kidney function, and potentially lead to kidney failure. Furthermore, NSAIDs may increase blood pressure, worsening kidney damage. Symptoms of kidney damage from painkillers include fatigue, increased or decreased urination, blood in the urine, back pain, lethargy, numbness in the legs, nausea, vomiting, bleeding, and widespread swelling. 13. Ignoring the urge to urinate, often referred to as resisting nature's call, can lead to several health issues, including kidney damage. When urine is not expelled from the body in a timely manner, it can lead to a condition called hydronephrosis, where one or both kidneys become swollen. If left untreated, hydronephrosis can cause kidney failure. Habitually delaying urination increases the risk of urinary tract infections, UTIs, as an overly full bladder becomes a breeding ground for bacteria. These infections can then spread to the kidneys and cause further damage. Moreover, retaining urine for prolonged periods can overstretch the bladder, potentially harming the bladder itself and increasing pressure on the kidneys, which may result in kidney damage. Additionally, Not responding to the urge to urinate can cause tears in the bladder wall over time. This can reduce the bladder's capacity and make UTIs more frequent, which can further complicate into kidney infection or sepsis. To maintain kidney health and manage the urge to urinate effectively, it's important to take regular bathroom breaks and go when you feel the need without holding it. 12. Ignoring urinary tract infections, UTIs, can lead to serious health complications, including kidney damage. UTIs are bacterial infections that affect parts of the urinary system such as the bladder, ureters, kidneys, or urethra. Most UTIs are treatable with antibiotics, but neglecting to address the symptoms can allow the infection to worsen. If untreated, the infection may spread to the kidneys, a condition known as pyelonephritis, which can cause permanent kidney damage or even sepsis, a life-threatening response to infection. The urinary system plays a vital role in filtering waste and balancing fluids in the body. However, when bacteria build up in the urinary tract, they can cause infections, leading to symptoms like pain, frequent urination, a burning sensation, cloudy or bloody urine, and a persistent urge to urinate. A 2014 study in the Turkish Journal of Medical Sciences focused on urinary tract infections in individuals with chronic kidney disease, highlighting that elderly patients, particularly women with kidney stones, were more susceptible to upper urinary tract infections. Therefore, if you experience symptoms of a UTI, such as burning or pain during urination, it's crucial to seek medical attention promptly. Your doctor may also perform tests if you have other urinary or kidney problems, such as kidney stones. Chronic kidney infections can lead to severe complications, such as pyelonephrosis, where pus fills up the kidney, potentially resulting in the loss of kidney function. 11. Ignoring high blood pressure is detrimental to the kidneys as it damages the blood vessels that supply them. This damage makes the vessels stiff, reducing blood flow to the kidneys and impairing their function. Additionally, the tiny blood vessels within the kidneys that filter blood may also suffer damage. The relationship between high blood pressure and kidney damage is concerning because it harms the nephrons, the microscopic structures that filter blood within the kidneys. When the blood vessels feeding the nephrons are damaged, they do not receive enough oxygen and nutrients, leading to further kidney impairment. This creates a detrimental cycle where kidney damage makes it more difficult to control blood pressure, which in turn can lead to kidney failure. A study published in the Journal of the American College of Physicians in 2005 explored how high blood pressure affects kidney disease in different ethnic groups. The research, involving 1,172 participants, found that the risk of kidney failure was 32% lower in the group with controlled blood pressure compared to those with usual or higher levels. This study underscores the importance of early detection and treatment of high blood pressure to prevent kidney disease. Preventing kidney damage from high blood pressure requires long-term management strategies. Lifestyle changes, such as increasing physical activity, maintaining a healthy weight, quitting smoking, managing stress, and reducing sodium intake, are crucial in lowering blood pressure. These changes can significantly reduce the risk of developing kidney damage. Additionally, medications specifically designed to lower blood pressure, such as angiotensin-converting enzyme inhibitors and angiotensin receptor blockers, play a key role in slowing the progression of kidney disease related to high blood pressure. 10. Poorly managed diabetes is a major contributor to kidney disease due to the damage it can inflict on blood vessels and nephrons within the kidneys. These tiny structures are responsible for filtering blood, and when they are damaged, kidney function is impaired, leading to chronic kidney disease. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, diabetes is the leading cause of kidney disease. About 1 out of 3 adults with diabetes will develop kidney disease. The National Kidney Foundation, NKF, also emphasizes that diabetes is a significant risk factor for chronic kidney disease, CKD, indicating that the longer someone lives with diabetes, the more likely they are to develop kidney problems. This connection highlights the critical importance of managing diabetes effectively to prevent diabetic kidney disease, DKD, which can progress to end-stage renal disease, ESRD, if not adequately treated. Furthermore, high blood pressure, a common complication of diabetes, can exacerbate kidney damage by harming the blood vessels necessary for filtering and regulating. Thus, managing diabetes involves not only controlling blood sugar, but also monitoring and managing blood pressure along with cholesterol levels. A comprehensive approach should include a healthy diet, regular exercise, adherence to prescribed medications, and regular medical checkups to monitor kidney function. 9. Skipping regular exercise can deprive people with kidney disease of several benefits, including better control of blood pressure, improved sleep quality, increased physical strength, and reductions in anxiety and depression. Conversely, the lack of regular physical activity can exacerbate kidney health issues. It's important to remember, however, that while exercise is beneficial, very intense activities, particularly in hot conditions, can lead to dehydration and worsen kidney conditions. Therefore, finding a balance with moderate, regular exercise is crucial for those with kidney concerns. Numerous studies have shown that sedentary behavior can lead to decreased strength and exercise capacity, which are common in patients with chronic kidney disease, CKD. A review by Cochrane in 2011 explored the benefits of exercise training for adults with CKD. The review included 45 studies with 1,163 participants and found that regular exercise improves fitness, increases aerobic capacity, and enhances the amount of oxygen the body can utilize by about 5 to 6%. Additionally, exercise helps reduce blood pressure and heart rate while improving the quality of life related to health. These findings highlight the importance of incorporating regular physical activity into daily life to enhance kidney health. To break the habit of skipping exercise and to support kidney health, aim for at least 30 minutes of moderate activity, such as running, cycling, walking, or dancing each week. If you are new to exercise or have kidney issues, start with gentle movements and gradually increase the intensity to avoid injuries. Regular, short exercise sessions are often more effective than infrequent, longer ones. To stay motivated and on track, consider using a journal or an app to record your progress and set fitness goals, and celebrate your achievements with non-food rewards. Engaging in enjoyable activities like gardening, walking with friends, or participating in community sports can also make exercise a more pleasurable and sustainable part of your routine. 8. Drinking sodas, especially cola-type beverages, can significantly increase the risk of developing chronic kidney disease, CKD, due to their high sugar and phosphoric acid content. The excessive sugar in sodas contributes to obesity, diabetes, and cardiovascular disease, all of which are risk factors for CKD. Additionally, phosphoric acid in sodas can cause urinary changes that promote the formation of kidney stones, further increasing the risk of CKD. A 2014 study published in the journal Nephrology Dialysis Transplantation reviewed 17 studies to examine the link between soda consumption and CKD. The findings indicated that regular consumption of sugar-sweetened sodas was associated with a 58% increased risk of CKD. Even drinking artificially sweetened sodas regularly increased the risk of CKD by 33% compared to those who did not consume sodas. These results suggest that reducing soda intake can help prevent the onset of chronic kidney disease. Instead of sodas, opt for healthier beverage choices like water, unsweetened tea, or low-fat milk to lower the risk of kidney damage. 7. Consuming processed foods, especially ultra-processed foods, UPFs, can significantly impact kidney health. UPFs are industrial formulations that contain high amounts of artificial additives, added sugars, refined carbohydrates, unhealthy trans fats, and excessive salt. These ingredients make processed foods very appealing and hard to resist, potentially leading to overeating. Moreover, processed foods are typically low in beneficial nutrients like fiber and essential micronutrients. They may also contain contaminants from packaging processes. Research highlights that a diet high in UPFs can be particularly detrimental to your kidneys. A study in the American Journal of Kidney Diseases found that people with chronic kidney disease who consumed more UPFs experienced worse outcomes and higher mortality rates. This study underscores the importance of dietary choices in managing kidney health. To protect your kidneys, it is advisable to reduce the intake of ultra-processed foods. Opting for a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support healthy kidneys and reduce the risks associated with conditions like high blood pressure and diabetes. Keeping a food journal can help you monitor your eating habits and make healthier choices. Additionally, consulting a renal dietitian can provide valuable guidance on dietary adjustments to support your kidney and overall health. 6. Sitting for long periods can significantly increase the risk of developing chronic kidney disease, CKD, regardless of other factors like physical activity levels, body weight, and smoking status. Studies have shown that those who sit the least have the lowest risk of CKD. Research from 2022 in the Sports Medicine Journal analyzed data from 455,000 participants over 21 years and found that prolonged sitting, particularly at work, was associated with a higher risk of kidney problems, including a 26% increased risk of chronic kidney disease, a 19% higher likelihood of requiring dialysis, and a 43% greater risk of death from kidney-related issues. Even minimal daily exercise, such as a 15-minute walk, was shown to help mitigate these risks. Therefore, it is crucial to reduce sedentary time to maintain kidney function and overall health. A practical tip to incorporate more activity into a sedentary lifestyle is to keep a small water bottle at your desk. Not only does staying hydrated help support kidney function, but the need to refill the bottle also provides a regular reminder to get up and move, offering dual benefits for your health. 5. Not drinking enough water leads to dehydration, a condition in which the body loses more fluids than it takes in, disrupting the balance of essential electrolytes like potassium, phosphate, and sodium. These imbalances can result in severe health issues, including seizures, involuntary muscle movements, and even loss of consciousness. Chronic dehydration can also cause kidney failure, exacerbate conditions like anemia and central nervous system damage, lead to heart failure, and weaken the immune system. Moreover, dehydration can increase the risk of kidney stones, complicate urinary tract infections, UTIs, and elevate the risk of chronic kidney disease, CKD. To prevent these serious health problems, it is crucial to maintain adequate hydration by ensuring a stable daily intake of fluids to compensate for daily losses. This helps the kidneys flush out sodium and other toxins while preventing kidney stones. However, it's important to balance fluid intake, especially in individuals with kidney issues, as excessive water can dilute essential electrolytes, leading to additional health complications. The kidneys play a critical role in filtering and managing the body's fluid balance, processing over 200 liters of fluids each day under normal conditions. To ensure adequate hydration and support kidney health, monitor the color of your urine. It should be a pale straw color. Darker urine is often a sign of dehydration. Limit intake of caffeinated, sweetened, and alcoholic beverages, as these can increase the body's need for water. Instead, choose plain water or other hydrating fluids to maintain proper hydration and kidney health. 4. Smoking has detrimental effects on kidney health, both immediately and over the long term. In the short term, smoking increases blood pressure and heart rate due to stimulation of the nervous system. Long-term effects are even more harmful, as smoking damages the endothelial cells lining the blood vessels, including those in the kidneys. Exposure to secondhand smoke, or passive smoking, is also linked to elevated enzyme activity in the kidneys, which can disrupt normal blood flow and lead to kidney damage. Over time, smoking can lead to decreased blood flow to the kidneys, contributing to conditions such as peripheral arterial disease and arteriosclerosis, which also affect the renal arteries. For individuals already suffering from chronic kidney disease, CKD, smoking increases the risks associated with heart disease, high blood pressure, and diabetes, all of which can accelerate the progression of CKD and lead to kidney failure. Research, including a 2007 study published in the American Journal of Nephrology, has found a strong link between smoking and the progression of CKD. The study reviewed 12 articles and highlighted that smoking significantly increases the risk of CKD progression, particularly in those who smoke more than 15 packs per year. Additionally, smoking is associated with an increased likelihood of developing proteinuria, an indication of excess protein in the urine, especially in individuals with elevated blood pressure and blood sugar levels. 3. Inadequate sleep has been linked with faster declines in kidney function and more rapid progression of chronic kidney disease, CKD. Sleep plays a crucial role in regulating kidney function and maintaining the body's balance of fluids and electrolytes. It also influences the regulation of hormones that are involved in kidney health, such as the renin-angiotensin-aldosterone system, RARS, which helps regulate blood pressure and fluid balance. Disturbed sleep patterns can overactivate the RARS, leading to elevated blood pressure and additional strain on the kidneys. Furthermore, a lack of sleep often results in non-dipping blood pressure patterns. Normally, blood pressure dips during sleep, which provides a rest period for the cardiovascular system and kidneys. However, poor sleep can elevate nighttime blood pressure, a known risk factor for CKD progression. Sleep deprivation also increases levels of inflammatory cytokines and activates inflammatory pathways. Chronic inflammation can directly contribute to kidney damage and exacerbate existing kidney conditions. A study published in the Journal of Clinical Sleep Medicine in 2019 investigated the relationship between sleep duration and the incidence of CKD in over 194,000 participants aged 20 years or older, spanning from 1996 to 2014. It revealed that individuals who slept fewer than 4 hours, 4 to 6 hours, or more than 8 hours had a 45%, 7%, and 12% increased risk of chronic kidney disease, respectively, compared to those who slept 6 to 8 hours. Conditions like sleep apnea, which are common in people not getting enough sleep, can further damage the kidneys. Sleep apnea often leads to repeated episodes of low oxygen levels at night, exacerbating the decline in kidney function. Additionally, chronic sleep deprivation is associated with several health issues such as obesity, type 2 diabetes, and hypertension, all of which are risk factors for CKD and can initiate or worsen kidney damage. To combat these issues and protect your kidney health, it is crucial to prioritize getting adequate and quality sleep. This involves creating a calming bedtime environment, establishing a consistent sleep schedule, and engaging in regular physical activity, which can enhance sleep quality. 2. Excessive alcohol consumption significantly increases the risk of kidney disease. Alcohol impacts the kidneys in several harmful ways. It cannot be filtered quickly enough by the kidneys, which leads to a buildup of toxins in the blood. Additionally, alcohol-induced dehydration can impair kidney function and alter the body's water and mineral balance. Moreover, liver disease resulting from alcohol abuse can further harm the kidneys by affecting the blood flow to these organs and increasing their workload. Furthermore, binge drinking can lead to acute kidney injury due to sudden spikes in blood alcohol levels. A 2019 study published in the journal Nutrients investigated the relationship between alcohol consumption and chronic kidney disease. The research followed 45,200 adults over 85 years and found that heavy drinking increases the risk of developing chronic kidney disease by 15%. It's crucial for individuals, especially those with medical conditions or on certain medications, to either avoid alcohol entirely or practice moderation. Excessive alcohol consumption can lead to increased blood pressure, which is detrimental to kidney health and overall well-being. 1. Excessive caffeine consumption can be particularly harmful to individuals with specific genetic variants, like the CYP1A2 gene variant, as it can exacerbate kidney function issues. Caffeine acts as a diuretic at high doses, promoting increased urine production, which can lead to dehydration and stress on the kidneys. However, in moderate amounts, caffeine may actually offer protective benefits to the kidneys by enhancing blood flow and reducing the risk of kidney stone formation. A study published in the Journal of Renal Nutrition in 2007 explored the impact of caffeine consumption on acute kidney injury among thoracic cancer patients receiving platinum-based chemotherapy, which is known for its nephrotoxic effects. The study found that patients consuming high levels of caffeine, over 386 mg per day, experienced a doubled risk of acute kidney injury compared to those with lower caffeine intake levels. While a moderate amount of caffeine is generally considered safe for most people, those with kidney issues or at risk of kidney disease should be cautious about their caffeine intake. To reduce the effects of excessive caffeine and protect kidney health, consider switching to decaffeinated beverages or opt for lower caffeine options. Additionally, it's beneficial to increase water intake to offset the diuretic effects of caffeine and help maintain proper hydration. Warning signs of kidney diseases can become more prevalent as people age, increasing the risk of developing kidney and urinary tract disorders. When kidney disease progresses to a severe stage, several symptoms might become noticeable. Swelling in hands and feet. This occurs because the kidneys struggle to balance fluids, leading to retention that bloats the body's limbs. Fatigue and weakness. A decline in kidney function can lead to a drop in erythropoietin, a hormone vital for producing red blood cells. This can cause anemia, leading to persistent tiredness and a lack of energy. Muscle twitches and cramps. Kidney issues can cause electrolyte imbalances, particularly with minerals like calcium and phosphate, leading to muscle problems. Cognitive impairment. A buildup of toxins in the blood due to reduced kidney function can lead to difficulties in thinking clearly, often described as a foggy brain. Back pain. Although often overlooked, back pain can be a sign of kidney distress, potentially from damage or kidney stones. Increased urination. An effort by the kidneys to expel waste more frequently can indicate distress, a symptom that should not be ignored. Recognizing these signs is crucial not just for diagnosing kidney problems, but for taking early action to prevent worsening conditions. Early detection and management can significantly alter the course of kidney disease. The National Institute of Diabetes and Digestive and Kidney Diseases emphasizes the importance of getting tested for kidney disease if you're dealing with diabetes, high blood pressure, heart disease, or have a family history of kidney failure. By adopting a healthy lifestyle, managing underlying health conditions, and engaging in regular physical activity, you're not just safeguarding your kidneys, but promoting a healthier, more vibrant life. Keeping our kidneys healthy involves avoiding certain daily habits that can cause harm. These include excessive salt, sugar, meat, and caffeine intake, as well as the overuse of painkillers, ignoring urinary urges and infections, sitting for too long, not getting enough sleep, and excessive alcohol and caffeine consumption. These habits tend to affect more than just your kidneys, impacting overall health. It's essential to prioritize a healthy lifestyle, which includes a balanced diet low in processed foods, staying hydrated, and avoiding harmful substances like tobacco and excessive alcohol. Additionally, embracing physical activity, aiming for a healthy weight, and managing underlying health conditions like diabetes and hypertension are crucial steps. If you have any concerns about your kidney health or are experiencing symptoms related to kidney issues, it's vital to consult your doctor for proper evaluation and guidance. For those interested in further information, the studies supporting our claims are provided in the description box below. To explore more common foods that can damage your kidneys, check out our next video. We'll also share tips on how to enjoy these foods or find alternatives that offer maximum kidney benefits. See you in the next video.